And it's not only the girl child, it's also the woman and the men also in the community. But for the girl child, it's more troubling because they have to deal with this whilst in school. And we know that in these areas, they are already handicapped with very little resources. You know, competing with schools in Accra here is not easy. Then now you have to also consider your health and mental hygiene, and even you're very lively, you're very survival, living in a Galamsey area. And I don't think it's fair for the girl child in those communities to be going through this. And that's why we need the government to really take a second look at this Galamsey issue, especially on how it affects women and girls. When we very well know that most remote, not remote, but places outside the urban areas, it's the girls' responsibility to go and fetch water. And they have to go through this, I don't even know whether to call it dirty or, I mean, it's just toxic, this toxic water on a daily basis. So even if you are not going through your mental period, you are exposing yourself so much to these hazards. And only God knows how it's going to affect our fertility in the next few years, how it will affect our population, because clearly fertility issues would automatically affect population issues. And I don't know if there's been any talk about that. I've not heard much on it. And I really hope that we hear something from the Ghana Health Service, the Ministry of Health, on direction on how to manage the situation. We are in already, it's a crisis situation. Just as the COVID time, we had direction on how to go about things. I think this is even more important or more critical than the COVID time. We need to know how to manage ourselves.